First of all, I'm so happy to be with you today. And thank you for all our colleagues for the nice presentations. My presentation will be about the uh, advanced nursing role in disaster and emergency management. I think it is a high priority for all the world. I am Yousef Al Shaabi, registered nurse, master degree, PhD, and fellowship from Ireland, and GNLI leadership program from Switzerland. Sorry. Okay. Okay. Disaster, according to their classification, are either natural, such as earthquake, volcanoes, hurricanes, tsunami, cold and extreme heat waves, rock and mudslides, desertification, winds, sand hurricanes, fires, floods, torrents, and the melting of ice in the north and south poles due to the global warming, climate change, and others. Or man-made disasters such as wars, nuclear and industrial accident, marine tanker disaster, aircraft accident, traffic accident, epidemics, drug resistant and emergency of new infection disease as happened with the COVID-19 or other man-made disaster. All global indicators in the report of United Nations for 23-24 confirm a significant increase in the number of disasters due to the climate change, wars, and other accidents. This means one thing, an increase in the rate of natural and man-made disaster in the near future. The health sector is the first sector responsible for the saving life and health people in the world, and nursing is the most important part of health system. Hence, the importance of nursing have advanced role in emergency and disaster management at the global level. Disaster in the world. A disaster-related mortality ratio that is nearly 6 times higher, similar to the last year. Nearly 3 or half times more disaster-affected people per capita than countries with a substantial to comprehensive coverage, lower than the last year, which was 5 times. 2.1 billion people preemptively evacuated 2015-2022, which 64% in Asia Pacific. Yet only third of all the countries report have a plan for the early action, where plans exist and activated life and livelihood as safe. Disaster in the world. The economic impact of violence was 19.1 trillion in 2023. Wars, armed conflict, regional alliance, terrorism, epidemic, biological risks such as COVID, nuclear threats, radiation, industrial, technological disaster, and effect of this on health and safety of the world. The 20th edition of the Global Risk Report 25 reveals an increasingly fractured global landscape where escalating geopolitical, environmental, social, and technological challenges threats stability and progress. This edition presents the finding of the Global Risk Perception Survey 24-25, which capture insight from over 900 experts worldwide. The report analyzes the global risk through the 3 time frame to support the decision makers in the balancing current crisis and longer term priorities. When we see these figures during the last 100 years, the increasing all type of disasters in the world, we see that the huge increasing of the all type of disaster. That means one thing, maybe the future more than disturbance and more than disasters. The current situation regarding to the role of nursing emergency and disaster management. After analyzing many recent studies, I put it myself in the world, which showed the following. There is a significant gap, defects, and weakness in advanced nursing care during disaster, in mitigation, preparedness, response, and in recovery. Specialized qualification in the field of emergency and disaster nursing is a very limited globally. The leadership role of nursing in disaster and emergency management is weak and is limited to providing care, although there are modest successful stories of nurses in the world. There is a significant shortage in the number of qualified emergency and disaster nursing in all countries of the world. A lack of scientific resources and update protocols for a various types of disasters, and we saw the days of COVID-19 as an example what happened. Weakness in cooperation, exchange of experience, and recent research in emergency and disaster management globally. No encouraging recent innovation in emergency and disaster. All protocols limit the role of the nurses in nursing care during disaster and emergency, such as triage, mass casualty, providing first aid, treating injuries, and critical cases in hospital. While the nursing framework must be expanded according to the global changes, developments, and needs. The advanced nursing role in disaster and emergency management that should be in the future. Note here I will highlight the advanced nursing role in general because the task is many. First, according to the WHO Hospital Safety Index tool for hospital resilience, nursing can play a great role in mitigation, preparedness, response, and recovery. Leadership role, this is from the advanced role what we suggested. The leadership aspects in emergency and disaster management agencies at the national and subnational level. The expansion of the scope of nursing leadership work will only be achieved by qualified and empowering them to play this role. We have a model and successful stories such as leaders and nursing leaders in Syria, Yemen, Sudan, and other countries, which in that countries they lead the agencies of leadership and management. The leadership role required a qualified nurses have a knowledge, experience, and awareness for disaster, for coordination, and with other sectors internally and externally, practice early warning method, preparedness response, team management, communication management, and different resources during disaster. Research and innovation role. In the field of research and innovation, nurses need encouragement, support, and guidance to contribute in research and innovation in emergency and disaster, keeping pace with the changes and needs, and encouraging the exchange of experience and information globally. This will enable them to play advanced role scientifically and practically. Whether in care management, early warning tools, risk analysis, or technology, and its role in emergency and disaster, the scope is very wide. Policies that enhance the nursing. We need a global policy that expand the scope of nursing practice, meet enhance the effective role of nursing, disaster, and emergency management. Actually, we start with the ICN. We have a project with the ICN to start to develop global policies for disaster and emergency. Nurses need policies that enable them to make important and decision-making during the management of various resources during disaster. Education role. Specialized nursing education in the field of emergency and disaster nursing with the advanced curriculum that meet the international and regional need for nurses capable to dealing with the different of disasters and emergency cases. Many universities in the world start to open this master and doctorate specialization degree in disaster and emergency, most of them from the nurses. In my country, in Yemen, we start since 3 years to open the master degree with the disaster and emergency management specialization. Most of them, they are from the nurses, and that can help them to play a big role in the future in my country in this area. My recommendation, establish a volunteer team encouraged with the developed education topics in the specialty emergency and disaster management with the specialist nursing curricula. Gathering expertise in emergency and disaster nursing in the world to work together in developing this specialty in a way to enhance scientific and practical development and protocol and research in emergency and disaster nursing. Thank you